From the Toronto Star, I'm Sabah Itazaz, and this matters. We know this has been a pandemic of reckoning in many ways, including the deep structural fault lines in how we treat our seniors. Reflected in the tragedy of Ontario's long-term care homes, the first wave of COVID-19 shone a harsh light on how under-resourced and ill-prepared Ontario's senior housing industry was. Has anything changed in the second wave? And how do we fix the system that's breaking hearts and snatching away the lives of elderly parents and grandparents who protected us once, and it was now our turn to protect? First, we'll talk to the Star's investigative reporter Moira Welsh on how we got here. And after the break, we'll speak to the Star's veteran housing and urban development reporter Donovan Vincent on how we need to build elderly care facilities in the future. Hi, Moira. Thank you for joining me again.
Hi, thank you for having me.
So, Moira, after the devastation that we saw during the first wave, and we talked about that, an explosive military report followed, and a lot of promises to do better. Do you think that Ontario has a better handle on the situation in this second wave of COVID-19?
Let's talk about deaths. As of September 22nd, 2020, there were 1,859 residents and 8 staff of long-term care who died from COVID-19. Using Tuesday's numbers from the Ministry of Health, we now have 3,274 resident deaths and a total of 10 staff deaths. So more than 1,400 deaths since last September, a much shorter time than the 6 months of the first wave. And it's really interesting. This morning I was talking with QP representative, and that's the union that represents thousands of frontline staff in long-term care. That includes personal support workers, registered practical nurses, housekeeping workers, and janitors. And they're talking to workers who are doing 14 to 18-hour shifts. These workers are saying the outbreaks cannot be controlled. It's devastating to everyone, to the staff, to the residents, and to the families. And so I think to answer your question succinctly, in some homes, things are better. I'm hearing that in some homes there are good quantities of PPE. People are really taking a proactive approach to keeping COVID out. And in other homes, it just seems to come in and then sweep through the different floors. So it's different in other homes, but they're the same problems in homes with serious outbreaks are continuing today. And that's the part that people are really struggling with. The staff simply do not have time to sit and help residents eat, for the most part. If we're talking about a home in outbreak, by this point, a lot of workers who've been through the first wave are exhausted from the second wave. I was told that one personal support worker who was talking on the phone with her union representative just broke down because she'd been working so many hours and trying to compartmentalize everything and not think about it. And then when she was asked to actually consider her experience, she just couldn't continue speaking about it, essentially. So we're just seeing, again, the same problems. A lot of people in long-term care have some type of cognitive decline, at least 80%. And means that they need a lot of prompts to eat and drink, and it's a really slow process. And often in the best of times, if they had a committed family member, that person would come in and help them. But in the middle of an outbreak, that is no longer happening in every case now. So in many cases, workers just do not have the time. Maybe they have 5 or 6 minutes to devote to one resident, but that does not help them with nutrition or hydration, which is necessary in a sense to give them a bit of strength to fight COVID if that's what they're dealing with. The PPE situation, again, one home to the next. It sounds like some have stocked up. Others, I'm hearing, for example, it appears from the ministry reports and from doctor I interviewed at Tender Care in Scarborough that they were running out of certain items. Some of the gowns might have been considered to be cheap and easily ripped, or I was told there's only one size for gloves. So that wasn't helping workers, although Tender Care has said that they were fully stocked in PPE. So we're seeing also, again, from the first wave, shortages of doctors who are contracted to work in the homes. There are many reasons why physicians don't go in. Sometimes they're afraid. Sometimes they're older people who've generally retired from their practice and are picking up this work on the side in their later years, and they don't want to be exposed to COVID, or they have vulnerable family members at home. But it is becoming a problem. And example, again, in tender care, they just didn't have any doctors on site, at least for several days. They were people coming and going, doctor coming in from the Scarborough Health Network, but sending out alerts on social media to their friends and asking them, who are also physicians, to come in and help out. And that's how I ended up interviewing one of the doctors who went in. And she spoke about staff trying to do an incredible job, doing their best, but also just struggling with lack of provisions needed to help people who were so desperately ill.
Like you said, there are different situations and different long-term care facilities, but the numbers that you're talking about and these individual stories that you're talking about are indicating that there's a long way to go before the situation gets turned around. And you've been on the front lines of the situation throughout this pandemic and reported on the tragic impact of COVID. Can you give us a sense of how bad it was then during the peak of this?
In the homes with outbreaks, especially the serious outbreaks, it was absolutely devastating to, again, the workers, the residents, and their families. There were so many people off sick from work or quarantined that, again, just like this time, this wave, residents had very little care, certainly not the care that they needed. And at that point, also, nobody was really talking about the impact of isolation, which had a major impact on people with cognitive decline and just simply other residents who were living in the homes. Loneliness is actually physically destructive, and we know that among older people, it is devastating. And I can give you an example. I think about this often. There was a man who had cognitive decline, and he was desperate for his wife, who had come to see him on a daily basis before the outbreak in his home. And he could only see her through the window for months. And he couldn't understand why he couldn't touch her through the window and why she could not come inside and hug him. And he grew deeply, deeply depressed because he thought that she was leaving him. And I remember the day when the outdoor visits were finally allowed, and he came outside to see his wife, and he was absolutely overjoyed. And it was such a special thing. The home actually let him hold hands with her. There was no way he was not going to hold the hand of his wife. And she later became an essential caregiver. So they are connected again. But it just really spoke to the emotional devastation that people dealt with. And I think the workers, again, are still really struggling in the first wave because funeral workers were not allowed to come inside the home and attend to the bodies. The frontline workers were suddenly told that they had to prepare and clean the bodies of residents. These are many cases, people they had become very close to, developed deep relationships with. And there's a process one has to go through, I'm told, to prepare a dead body to be put in the body bag. They had no training for this. And they were required to do that and then wipe the bag with their resident in it, wipe it down with bleach. They're still doing it now. And that is soul crushing.
Yeah, this is so difficult even to just hear. I can't imagine how this must have been covering this for you. And I can imagine these stories that you're talking about are what stayed with you from reporting on this, right?
Yes. And I'm not living it in real time in myself. I'm hearing about this from people. So there's a big distinction, but absolutely. I think the trauma piece of it is something that will stay with me and many, many people for a long time. And really, it's what the families and the workers are feeling, not what I'm feeling, but just hearing their stories is, I think I'm very aware of what will be a very long-lasting devastation that people will be experiencing for many, many years, or probably the remainder of their lives. The fact that they knew that their mother and father was inside a home, was suffering because COVID, in many cases, not all, but in many cases, is a pretty awful death. And they were alone and they died alone. And there was simply nothing that the family could do. And at the same time, for workers, again, these are people that they cared for. They didn't have the time to care for them properly in homes with the worst outbreaks. And they saw how they were dying. And there were descriptions given to me from the first wave of people gasping for breath. And that's a really awful thing for these people to have experienced, or for families to know that their mother or father went through.
Thank you so much, Moira, for sharing your reporting and your insights with us.
Thank you so much for giving me the opportunity to talk about it.
That was investigative reporter Moira Welsh, whose book on approaches to long-term care, titled Happily Ever Older, is coming out soon. We'll be right back. So how do we fix this? Some are calling for a societal reckoning about how we think about our elders and the very design of spaces that they occupy. The Star's housing reporter Donovan Vincent is going to explain. Hi, Donovan. Thanks so much for being on.
Hello, Saba. Thanks for having me.
So, Donovan, you've spoken to experts about this who are saying that the way we saw the COVID-19 outbreaks devastatingly play out across Ontario's long-term care homes and other senior facilities, it had a lot to do with the way these places have been designed. In fact, one of the experts that you spoke to called this the perfect microcosm for the spread of disease. Can you explain that a little bit more?
Exactly. The way that a lot of the long-term care homes, retirement homes, nursing homes are set up, they're very congested. So you have, for instance, a lot of long-term care homes, you have double-loaded corridors. So in other words, you've got a corridor pretty narrow that has units on either side. And so imagine two people opening the door and walking into the hallway at the same time, or several people doing that. It's very hard to physical distance. It's very hard to have that 6-foot separation. So that's a key part. We know that physical distancing and keeping people apart, that's a key part in terms of fighting COVID-19. So that set up in a lot of these facilities, the congestion, the crowding is a big problem. The other problem is the staffing. Folks who are staffing these facilities are often moving from seniors home to seniors home, or nursing home to nursing home, or retirement home to retirement home, and even within wings of these specific facilities as well. And they're carrying germs, and they're also spreading them around. So these are the types of problems that make them, as one expert said, a perfect microcosm for the spread of COVID-19.
So concerns around spacing and staffing are among the chief concerns.
Absolutely.
And as you mentioned in your piece, until now, a lot of the focus on how these facilities have been designed has been on chronic illnesses. And no one sort of designed these places with a virus, a global pandemic in mind, right?
Exactly.
Has this sort of been a moment of reckoning for the seniors housing industry?
Absolutely. As you say, I mean, some of these seniors' homes, they're 20 years old. They were built for exactly chronic illnesses, people with heart ailments or diabetes, arthritis, all these types of age-related kinds of illnesses. People sort of focused on that. You've had flu outbreaks, of course, and different Norwalk virus, those kinds of things that, that can cause problems, but nothing like the pandemic that is taking lives to this extent. So nobody ever thought really of this type of virus really taking hold. So it's absolutely been a reckoning for the industry. This is an industry, too, that has limited funds as well. A lot of these seniors facilities operate at fairly narrow margins, not huge profit-making ventures. A lot of them are provincially funded. And so to now make these changes, a lot of these operators are kind of looking at their designs, looking at government for help. Designers are really engaging now in these conversations, architects, and it is an absolute moment of reckoning. How do we now deal with not only COVID, but any future pandemics that come along? We have to now build these facilities with this type of problem in mind. And that has opened up all of this dialogue and conversation about how best to do that.
And when we talk about some of these ways, I was reading that there are some facilities that are looking at ways to implement infection control right into the design. How would that work? I know you've done some work reporting on that.
So a big part of the discussion that's happening right now is around this small home movement, small house movement. And typically, a lot of long-term care facilities, the funding that they receive calls for about a model of about 27 to 32 beds per wing or per unit of a facility. Now, some of these facilities have, 600 beds or 300 beds. They're quite large, but they're kind of divided up into these wings. And now a lot of experts are saying even these wings are too large. So maybe let's look at a wing that has 8 to 10 beds, or maybe 10 to 16 beds, smaller rather than this 27 to 32 bed wing. Let's look at smaller clusters of people. So that's one area of thought that is really kind of taking off. Now, an impediment to that is the provincial government stipulates that the facilities must be, have this 27 to 32 bed size. The funding is kind of based on that model. And so what a lot of experts are saying is, look, the province now has to go back and figure out ways to continue to fund these facilities, but at these smaller wing sizes. So that's one of many suggestions that are being discussed. Talking about things like having separate entrances for staff, that where you would come in at a separate point. Visitors and residents wouldn't be accessing these points. This would be just for staff, and they would be screened at this point and checked out. They're also talking about different change rooms that are just for staff so that they can get in and out of the garments that they're wearing as they're moving around. As we know, that can be a big source of spread, your clothing. So if you have a separate room, oftentimes, as one expert said, they're kind of just tucked away in the basement of these facilities as an afterthought. You have to prioritize these change areas. Things like storage of PPE and cleaning facilities and all that kind of stuff. Again, a specific room for that is closed off, that is, germ-free, and that is protected. And then another area that a lot of experts and designers are talking about is separate entrances also for wings, separate entrances to the wings that access the residents themselves, so that a visitor can come in to this separate wing. And that's also cutting down on, again, the flow of traffic. Maybe it's even a control point where they can be measuring the temperatures of people coming in and out of these points. Also, having outside space. First of all, for the mental well-being of residents, it's good that they have these outdoor courtyards so they can get fresh air, but also, social distancing in those courtyards with relatives or with other residents, and still enjoying the outdoor and getting fresh air. So these are some of the design ideas that experts are really kind of talking about.
And Donovan, how much would technology be playing a role in helping protect senior residents? COVID-19 has been such an eye-opener in that regards as well, how we've all had to totally rely on virtual and digital interactions for everything, even medical help. So would that play a role in this?
Absolutely. A lot of the experts are talking about giving seniors more access to things like iPads and computers, even having kind of Zoom connections in their room so that maybe a doctor or a clinician can look at them, observe them, and ask them questions rather than having to be in that actual unit and having these clinicians and doctors walking around all over the place. They can be in their office, telemedicine basically, using that to having that technology in the residence units. We're also talking about things like machines that can use ultraviolet light to kill germs, including viruses such as COVID-19. There's a germ zapping machine that's been developed in the United States. A lot of facilities are now using this technology. The problem with it is it does come at a bit of a price. Their units are about $135,000 Canadian. So, there's a bit of a price tag with that.
It's expensive.
Exactly. Things like HVAC, the heating, ventilation, and air conditioning systems, these all have to be looked at as well, because we know that air circulation is a huge vector point for the spread of COVID-19. You've got to look at these often very antiquated air circulation systems, replacing them and putting in better ones that improve air circulation. Another way, it's not exactly technology, but there are cleaning solutions that are good at knocking out viruses and COVID. And also, you have to look at the types of surfaces that can withstand heavy cleaning and can withstand a lot of these germicides, these cleaning solutions. So you have to look at tables and furniture, the leather, all of those things. making them more durable to heavy cleaning.
So more creative and innovative solutions are clearly needed. And this is something that we've been reporting on before as well, about how these facilities aren't supposed to be storage for the elderly. They should be places that they have a good life, a quality of life. And this pandemic has only brought that more starkly into focus, right? Are there any other suggestions in terms of designs and building standards that we could implement to prevent this kind of deadly infection spread, but also make lives better for senior citizens?
I mean, I think it's just a matter of kind of really putting it on our radar. We always have this issue around senior care and we care about seniors and, they're sort of getting general public kind of motivated to address these solutions because, as I said, they come at a cost. It's not going to be cheap to make these changes. So there has to be a conversation that involves designers, architects, clinicians, staff that work in the long-term care homes, residents themselves, and family members. They all have to be involved in this part of this reckoning, part of this conversation. In terms of designs and renos, the one thing I should point out is that the renovation part is a bit tricky if you think of, again, controlling germs. You've got workers who are going to come in and make some of these changes, whether it's putting in a new HVAC system, whether it's things like touchless faucets, being able to have elevators that rather than pushing the button on the elevator, which can be a source of germ spread, you could maybe use your cell phone. All of these things would require workers coming in and fixing these things or replacing these, putting them in. And so how do you do that when you have seniors who are already vulnerable to viruses? You're introducing yet another source of potential new viruses with these workers. So do you have to move the seniors to another wing? Like, how do you, just the logistics of making these changes is also a tricky area that really has to be talked about when we have this discussion.
Thank you, Donovan. You've been very insightful.
No problem. Thank you.
That was the Star's housing reporter, Donovan Vincent. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by SoCalled, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.